I'm Dr. Diane Calello. I'm the Executive and Medical Director of the New Jersey Poison Control Center. I'm also a Professor of Emergency Medicine and Pediatrics at Rutgers, New Jersey Medical School. What drew me into toxicology initially was just the elegant science and pathophysiology of poison and toxic exposures, and then the ability to teach that. My current primary focus is to expand the reach and scope of the New Jersey Poison Center. You know, we serve the entire population of New Jersey and beyond. And I think a lot of people don't realize all of the things that we can actually do. Whether it is an accidental exposure to a household substance, or it's responding to drug overdoses, or helping to surveil and mitigate the opioid epidemic, or it's even just quelling fears of a perceived threat that people might read about in the news or social media. And so just doing as much as we can to expand our impact is my primary focus right now. I think what keeps me motivated on the days that are most difficult is knowledge of our ability to have impact. The New Jersey Poison Center was the first poison center in the country to be a COVID hotline. We were energized by knowing how many people we were helping, even if it was just the ability to be a person on the other end of the line at a time when what people really needed was to talk to other people and hear another voice. That to me feels like making a big difference, and I think what gets you through the most difficult days is making a difference. I think no matter where you are in healthcare, it's very crucial to be an agile communicator and be able to talk to multiple kinds of people with differing levels of education and impart the knowledge that you worked so hard to gain to make their lives better. The ability to bring your level of communication and listening to that encounter is more essential than it's ever been. We've got a lot of challenges about how information is disseminated and how to counteract things like misinformation. And being a good communicator, I think, is the most effective antidote. Working in healthcare is a vocation and a privilege. We have the ability to help people and their families and their loved ones with something that is more important and more consequential than just about anything, and that is keeping them healthy. I really appreciate being selected for this award. It's nice to be recognized and to be in this room with all of these other esteemed recipients of the award. Being selected for this award is part of the work of many people. And even though I am the Executive and Medical Director of the New Jersey Poison Center, that is an entity with an awful lot of people doing a lot of work. And so I'm grateful to be recognized, but I feel like I also share in this recognition with everybody who's doing this work.